Dr. Oz, we are now several days into the 15-day guidelines from the White House. I know we can't go through every single community, but big picture, how do you feel we're doing in terms of progress?
You know, the cities like New York, which now represent 1/3 of all the virus load for the country, are still suffering. Other parts of the country haven't accelerated as quickly. I think we're seeing that earlier action before you've got the loss of the virus, you can't contain it anymore, works. So I'm hopeful that most of the country will be spared. And we're cracking down hard here in New York, in California, as you mentioned earlier. But I'll tell you the most impressive bit of news on this entire pandemic front. It was the paper from Marseille, France, yesterday that many and I, I'm sure, and our colleagues are all stunned by. They took two old drugs, a malaria drug and a Z-Pak, which is used for infections, an antibiotic, and they demonstrated they could reduce the viral load on people within 3 days, and all the virus is gone in 6 days. If that's true, and that's what the president was speaking about yesterday, that dramatically changes everything. Then all of a sudden, we can suffocate this virus much more rapidly. It'll behave more like the traditional seasonal influenza, and a lot of the pain that we're anticipating going through might not be needed.
Dr. Manny, are you hopeful and optimistic as well? Dr. Oz puts an important element on the table there.
Absolutely. I think that between the programs that are being instituted, and just like Dr. Oz, I'm very bullish on this chloroquine protocol. I think it has shown, at least in preliminary results, that it does decreases the viral load. It has a good scientific functionality when it comes to viruses entering the cell, and is a drug that we have a lot of experience with. So I think that if we continue and show promise that this is a pathway to treatment or to prevention, is going to really change and make that whole window a little bit shorter.
Dr. Oz, I want to throw up the White House 15-day guidelines because we are about to hear from the White House again. They continue to alter and change their guidelines, or we've just seen them evolve, period, over time. But of course, the gatherings of more than 10 people, we are told to avoid those. Homeschooling when possible, avoid discretionary travel, avoid eating and drinking at bars, restaurants. Obviously, that's happening because so many have shut down. Quarantine entire household if one member is diagnosed. Focus on protecting the vulnerable. Obviously, that message continues as well. But for so many, Dr. Oz, and I'm sure you walk down the street or you get phone calls from your patient, people can drive themselves nuts with trying to keep their house clean, trying to prevent their kids from seeing other kids when they go out to play for a few minutes. I mean, what is your message this morning about how we can stay sane through all of this while also protecting our family?
You know, over the last 24 hours, I've seen a massive transition from a period where doctors were yelling and screaming with nurses and other health experts saying, we got to pay attention, we got to get on this virus. And now I think we mostly are feeling more optimistic than the average American is. I'm seeing more of my late friends and colleagues, I'm hearing from viewers who are more panicked than I think is appropriate based on what I know. And I'm hoping Manny and other doctors will be loud about this. If we're getting optimistic as doctors, as clinicians, you should be feeling better about it as well. Now, we are seeing some potential benefit from the investor community, right? They didn't sink the stock market yesterday when we continue to have worse numbers because everyone has sort of expected this is the course. But I feel more bullish about this process than I have in a long time, in part because of this new data, but also because the government has finally done what we knew would work. And it will take time. You know, when you're putting in, when you're going to cause pain, you can do it fast, you can do it slow. You can rip off the Band-Aid or do it slowly. We finally, we did it slowly, but now the Band-Aid's on. So let's manage the emotional issues. We don't want to have the emotional problems outweigh the true clinical risks.
Dr. Manny, do you share that optimism?
I do, and you know, for a couple of days now, I wanted to be very optimistic. You know, sometimes we become optimistic, and we get criticized by other people because we say, oh, they're not taking this serious. We are taking this serious. We want the social distancing. We wanted the research to go. We want the federal government to be prepared with any kind of potential issues that they need to do, and we want the governors and the states to follow through. But I am getting optimistic. I think that, you know, the shortages of things that, you know, people are predicting is going to be, you know, it's not going to be real in the short term, let's say. I think that these protocols, clinical protocols, are going to make some changes which are positive. I look at all the research that's being done by biotech companies, whether it's, you know, plasma therapy, whether are these medications. I think there's a lot of good work coming out of this, and I think that we're going to beat this.
All right, gentlemen, we've got under a minute, so real quick lightning round to both you. Dr. Oz first. About a week ago, when you talk about that balance in terms of taking it seriously but not panicking, there were a lot of people predicting, look, hospitals are about to face these dire consequences. There's going to be so many new patients. Do you think we're starting to turn the corner? We're starting to flatten that curve that Dr. Fauci talked about?
It's impossible to tell. And I don't know about supplies. My hospital, New York Presbyterian, is getting squeezed. I'm looking for masks. And there are some things we haven't thought about, like the blood banks are saying, wait a minute, people still have to donate blood for emergency cases. Some of the blood products don't last that long. So there are things that we still need to manage in the supply chain. But we will suffocate this pandemic virus, and it will not take us more than the 4 weeks that most people expect, even if we have 8 or 10 weeks of pain.
Dr. Manny, last word?
Well, I echo what Dr. Oz says. We have to be vigilant. We have to keep the pressure on, and we have to keep the social distancing. Now we have to focus on people that are staying home, children, people with mental disabilities. That always concerns me a lot because, quarantine folks like that sometimes is a little problematic. So I think we have to multitask in this time of need.
Stay inside. Those are doctor's orders. We've got two of the best doctors right there. Thank you for your advice this morning. We appreciate it.
Thanks to both of you.
Thank you.